global happenings today. We communicate, we analyze global news. Stay tuned.
Hello beautiful people, welcome back to our channel. This is breaking and this is coming from Sahara Reporters as they're giving us privileged information on what is going on in the government house, not just the government house, particularly with the FCT Minister. A lot of Nigerians having observed for a while now the tight itinerary of the FCT Minister would agree with me that he at some point needs some level of rest. Well, as we speak, it looks as if the rest is on the way, but this time around is with some info that is definitely bringing cause for concern. But before we go into the news proper, please subscribe to our channel. Now, according to the news, the Minister of the Federal Capital Territory, FCT, Wike, will be traveling to the United Kingdom for medical attention. Sahara Reporters has learned. Now, sources privy to the Minister's health status told Sahara Reporters that Wike, has been diagnosed with congestive heart failure and is currently under medical management. Now, doctors reportedly recommended a bypass surgery, but Wike declined the procedure over concerns about being away from his duties for an extended period and the possibility of being replaced during his absence. Now, Wike is traveling to the United Kingdom, that's UK, to seek medical attention, one of the sources said. Now, they said he's got congestive heart failure, which is being managed. He refused to do the bypass surgery recommended because he doesn't want to be gone far too long or replaced. Now, the minister's decision to seek treatment abroad comes amid growing public interest in his health and capacity to continue in office. Now, in April 2021, Wike, the then governor of Rivers State, declared that he would not travel abroad for medical treatment, asserting that all the necessary equipment for examinations and care was available at the government house. He made the statement during a courtesy visit by the accreditation team of the Medical and Dental Council of Nigeria, MDCN, to the Rivers State University College of Medical Sciences at the government house in Port Harcourt, Rivers State. He said, and I quote him word for word then, he said, "It is unfortunate where we are. I don't want to comment on people who are traveling for medical check. I have not traveled for the past 2 years." That's when he was governor of Rivers State. I'm still quoting. "If we have all these things here, why do we have to travel? We have all it takes to provide it. Why will I go out to do my checks, which is abroad or overseas, when I have all the facilities in government house? I don't need it," he said. "Everything that is required for me to undergo any test is here. The resources we have it. Why can't we provide it for our people?" In October 2021, while inspecting construction work at the Cancer and Cardiovascular Disease Diagnostic and Treatment Center in Port Harcourt, then Governor Wike emphasized the government's responsibility to ensure citizens have access to quality health care. He highlighted the importance of a well-equipped healthcare delivery system and adequate support for medical professionals to safeguard lives. Wike noted that Nigerian doctors and medical experts can deliver effectively if provided with an enabling environment and proper incentives. He stressed that the country already has the resources and facilities needed to improve the health sector and emphasized the importance of training and retraining medical personnel. Wike pointed to the Government House Hospital in Port Harcourt as an example, highlighting how patients continue to visit due to availability of basic facilities and the dedication of doctors who are motivated by the supportive environment. According to Wike, and I quote again word for word, "If you give our people the required environment and give them the facilities, the tools to work with, there is no need for us to travel overseas. Earlier this year, of course, reports emerged that Wike had collapsed and was immediately flown abroad for treatment. However, the minister later dismissed the claims, describing them as false and politically motivated. In April, during an inspection tour of some project in the nation's capital territory, Abuja, Wike said, "I don't want to give credence to people who are only interested in spreading rumors. First of all, I am a human being, not a ghost. If someone collapses, it is a human being that collapsed, not a ghost. Unfortunately, I did not collapse. There was never a time I collapsed. There was never a time anybody took me anywhere for medical attention. People who spread such rumors would focus on reality, or should focus on reality," he stated. Wike accused his political detractors of fabricating the story to distract the public from the country's real issues, dismissing their claims as baseless. "I will sign their condolences," he said. That was many months ago, but as we speak, this is coming from Sahara reporters, and according to them, they say they are privy to some information about Wike traveling abroad. Okay, quick one. They took time to explain also that Wike, when he was the then governor of Rivers State, did make the promise. He made a promise that he wouldn't need to travel abroad for any medical checks because all he needs are actually in government house. They're in Rivers State. And if you ask me, from Abuja to Rivers State, just a flight away. And if he needs any medical attention, by all means, just to go back home if there is none in Abuja. And that brings us to the issue of facilities. Now, why are we always having this medical tourism? Is it that Nigerians don't deserve the good things of life as well? Our doctors are leaving the country in their droves. Their salaries are nothing to write home about. They're not motivated to work. You can imagine a doctor working for a very long time. No breaks, no shift, because we have very limited doctors remaining in the country. And you want them to still remain? Our politicians are well paid, while our medical doctors and teachers are underpaid. The guys who do the real deal, our soldiers and military personnel, are underpaid. The guys who do the real deal, and those who just sit back and say the eyes have it, are the ones even demanding for increment in salaries. Wow. But meanwhile, it's normal that like every other human being, he's a hard worker. No matter how you want to look at it, hate him, love him, Wike is a hard worker. You can't take it away from him. From Rivers to Abuja, you would always hear him. Wike is always in the news, whether for the right reasons or for the wrong reasons, he's always in the news, always doing something. So yes, he works virtually all the time, and like every other person, he deserves rest. While I'm not privy to his medical status, but everyone would agree with me that sometimes he looks dehydrated, he looks tired, he looks like someone who really needs rest. And if he demands rest, I don't think he's asking for the extraordinary. He's not a machine, he's a human after all. And that he's going to hospital for whatever medical checkup is, he has earned it, he deserves it, because he's but human. Even doctors at some point in time also need some rest. So I think it's not out of the picture for him to need rest. But it's the manner through which it is being played out that is making it look as if he doesn't deserve it, or rather he's swallowing his own vomit. That's where we're going to wrap it up. Let's meet in the comment section. What